Support for your public radio station comes from our members and from Genesee Country Village and Museum, hosting the Fiddle and Folk Festival, a weekend of music, craft, and community with 6 stages of live entertainment and folk music across the historic village this Saturday and Sunday. Tickets at gcv.org.
From WXXI News, this is Connections. I'm Racquel Stephen. The COVID-19 pandemic put a spotlight on the nation's nursing shortage. Hospitals and long-term care facilities were often forced to call in backup to help alleviate some of the caseload. The support often came from travel nurses. These contract nurses are usually hired through an agency and are on assignment for a specific amount of time, usually months or shorter. They can take over for staff nurses for any reason, like maternity leave, disability, nursing strikes. Simply put, they make up for staff shortages when necessary. According to the U.S. Bureau of Labor Statistics, 3 million registered nurses work in the U.S. and almost 2 million of them travel. The Bureau also reported that job growth for travel nurses grew by 35% between 2019 and 2021. But hiring these essential workers can get pretty expensive for healthcare systems. Travel nurses require higher pay rate than regular nursing staff, and being the new kid on the floor can sometimes come with contentious work environments. Today, we discuss the benefits and challenges of being a travel nurse in the current healthcare climate and how local institutions are trying to accommodate everyone. We have several guests joining us for this conversation. I have here with me in studio. Everyone is in studio. I love a full house. I always say that. I love a full house. Everyone is in studio with me. I have Shante Hill. She's a registered nurse, a traveling nurse based in Rochester, and she is all over, like she calls it. Hi, Shante. Thank you for joining us.
Good morning.
And I have here Jeri Hayes. She's a licensed practical nurse. And you're from Houston. You live in Houston.
I live in Houston. I'm from Rochester.
You're from Rochester.
Yes.
You live in Houston, and now you're on assignment back in Rochester.
Yes, ma'am.
Okay,
Yep.
just getting that right. Okay, travel nurse indeed. And we have Brandy Brumfeld. She's director of nursing at Wesley Gardens Nursing Home. Thank you for joining us,
Good
Brandy. And Daniel Ireland, the Chief Nursing Executive with Rochester Regional Health. Thank you for joining us, Dan.
Well, thanks for having me today.
Okay, we're going to play nice today, right?
Absolutely.
Yes. We're talking about travel nurses. Before we get into this, I want to talk to Shante. Can you tell us a little bit about your nursing background and how long have you been a nurse and when did you become a travel nurse?
So I have been a nurse since 2009. I graduated from GCC. I got my bachelor's in 2015 from the University of Rochester School of Nursing. I worked at one of the hospitals for about 5 years, and then I ventured off to start my travel nursing 2014. So first I started off working in schools, and then I actually stepped foot in, my first assignment was in Hawaii. I started in Hawaii in 2016, and after that I got the travel bug, and I've been all over the place. So I've been to Hawaii, I've been to New Jersey, Pennsylvania, Oregon, California, and I'm licensed in 12 states, so I'm all over the place.
Oh wow. Okay.
And I enjoy it all.
You enjoy it all. And this travel bug, what made this travel bug stay with you?
So the travel bug stayed with me because I'm an adventurous person. I'm a people person. I love to help others. And when I do travel, I meet other nurses. I love to communicate with them. We share ideas. Where do we go next? We help each other out, and I just love that. And I still talk to a lot of the nurses that I met from 2016. So even outside of work, a lot of people know me outside of my nursing, and I'm just a people person. I get along with everybody. So that's what I love about it. So
and I know you're hired through an agency. Can someone break down how do you become a travel nurse, and do you have to find an agency and work with them? How does that go?
So for me, when I started out, you can go on Indeed or, Hearsay, like I said. I found mine going on Indeed, or like another coworker said, hey, apply to this job. So what I would do is, first of all, you have to have at least 2 years experience working on the floor or in your specialty that with nursing, and you go from there, and then they assign you somewhere And then you go from there and just go to work.
Okay. And Jeri, so you don't go through an agency all
No,
the
so
time?
you do. Yeah, you do have to go through an agency all the time. Yes.
Okay. And Jeri, tell us about your experience as a travel nurse. You're originally from Rochester. You moved to Texas. How long were you in Texas?
So I actually got my nursing license here in New York,
Okay.
in Rochester, New York. I worked at the Jewish home for 6 years, and then during COVID, the opportunity for me to travel opened up. I was in a Facebook group, and a recruiter called me, and I was like, okay, so I really get to go somewhere. And my choices were North Dakota or Alaska. And I have the travel bug. I'm an Army brat, so it's embedded in me to move around. So my kids told me, no, don't go to Alaska because people come up missing there. So I took my first assignment in North Dakota as a prison nurse. So that was my first experience working outside of long-term care, because I was a CNA before I was a nurse. So I've always been in long-term care. So I was like, I want to do something else. So I went to North Dakota. I also been to California. I've been everywhere too.
So what made you come back to Rochester?
Family. I have family. My parents, like right now I'm staying with my parents. So I have family here. My oldest daughter still lives here. So I go back and forth a lot, and travel nursing just makes it easy money-wise. So I could come here, I could spend time, and I do short assignments now. So 6 weeks or less.
6 weeks or less. Okay.
Unless I'm going to Hawaii or something.
So you are able to extend for as long as you like?
Oh, yes.
Or is it, okay.
Yeah.
Oh, wow. Okay. And what's the longest you've been on assignment?
I did an assignment in Bath, New York, and I was there for a year and a half at the VA facility. So they took me in for a year and a half, and I just, as long as it's 50 miles away from your home, it's considered travel. So I just did the hour drive every day, and they paid me well. I had great benefits.
Yeah. Well, and Shante, you Hawaii was your longest, I assume?
Yes, it was. And you know what? And basically, that was a work dream job destination.
Yes.
I did my 312s, and my 4 days I had off, I was at the beach. So when I came back home, I had so many bathing suits. I had to unpack because I did my 3 days, and it was so awesome. But yeah, that assignment was really great. So.
And have you ever done an assignment where you felt not welcome because you weren't there? How has the culture been? Different places.
I'm on right now. It's always different because you do make a little bit more than the other nurses make. And they kind of, sometimes they feel like you think you're better. I don't know how we think, but they think you're better than them, or they, but we, on the contract, it specifically says like what hours we're supposed to be there, what shift we have to work, and we have to stick by that. So where a lot of other people, they can switch their hours around, we have like and you could finagle that once you're in there, but we just go in there and we say, well, this is what I have, this is what I'm going to give. A lot of times we're here because we want to see, outside too, but we're also giving our service to this place. So you get your head bumped a little bit. Yes.
So what is an ideal assignment for a travel nurse?
Hawaii.
I think an ideal assignment is good pay, a good area, good co-workers, a good facility, good resources, and that's it. That make or break where you're traveling to. I've only had one experience. I was in California because I've been there numerous times, and they gave me a horrible assignment. And I think I was probably a few years in, and I almost cried in the room and was like, why am I doing this? But then I had to snap out of it. I was only there for a few weeks. So I was like, why did they give me this horrible assignment? But like I said, that was my only, out of my 16 years of nursing, that I've had that experience where I'll question why am I a nurse?
Yeah.
So afterwards, after I got off that assignment, I was like, okay, I'm back to it again. Let me find something else that's a little bit better, because I was like, I can't go back to this facility because they just did me any type of way.
So I want to ask you, why nursing? Why nursing as a career choice for each of you?
I never wanted to be a nurse. Never. That's a secret that most people don't even believe about me because I'm so good at it. when I was like 19, I just needed a job, and my aunt got me a job doing, I was an aide, but I wasn't even certified yet. And I became certified as a CNA. And when I was at the Jewish home, my supervisor signed me up for nursing school. He was like, you are too good at what you do. You know too much. You should make more money. You should move up. And I got a letter from REOC accepting me for the interview process. And I was like, I didn't do this. But I love it. I love being a nurse. I am a nurturer by nature, and I'm very empathetic. So I'm one of the good ones. So, yeah.
I became a nurse because my mom is a nurse. So I just seen her like, oh my gosh, she's helping people. So I just seen how well she worked with people. My mom is a great nurse. So I said, this is what I want to be. I wanted to be a neonatal pediatrician, but I probably would have just graduated school if I did that. But, but that's why I wanted to be a nurse, because of my mother.
Yeah.
So,
And Brandy, let's talk to you. Why this field?
So nursing is my passion. I enjoy caring for people, taking care of them, educating, leading, and my nursing career has put me in positions to where I'm able to help others know and see, you can do this. You can get here. I was first the LPN. And as an LPN, sometimes you're being told that you have to be an RN to do this, to do that, to do this, to do that. And it's not true. There's so many things you can do as an LPN that I was able to experience. I've been in management. I was an LPN for like a year, and I've been in management. I've been in nursing for over 15 years, and I was a LPN cart nurse 1 year, and I've been in management since.
Wow.
A lot of people don't know that. As an LPN, those things can happen. You can be a supervisor. You can be a charge nurse. You can be, a resident care director. You can do a whole lot of things. And me being in some positions that I was, had the opportunity to be in, I was able to help people grow in their careers and become directors, supervisors, managers, and it just gives a lot of hope to people.
Wow. And at your facility, Wesley Gardens. As a director of nursing, what role do you play if travel nurses are needed?
Okay, so we currently have travel nurses now because, it's very competitive and, you can't pay what everybody pays. And, so the nurses know that they can go other places. So as a travel nurse, the things that we look at, we have a schedule. And typically travel nurses make their own schedule. They say, when you're coming into like a facility, you say, okay, I can work these days, or you just pick up, send me what your openings are and I'll see what nurses are available to work. In our facility, we kind of changed that up a little bit to meet our needs, because you have a lot of nurses that don't work weekends, don't want to work evenings, want to only work this, 2 days, or, so the benefit of having an agency nurse or a travel nurse come into the facility, it has to be able to benefit the facility. So we look into what the nurse is able to do, what she's able to offer, the facility, and we kind of work around that. And with the agency, it's very competitive too, because it depends on what they're paying. It depends on what's required and things like that. So all of that plays a big role into even signing the contract with the agency.
So Dan, it seems like a long-term care facility and maybe a hospital have different requirements for travel nurses, would you say? Or
Well, I think it circles around the needs that the institution has, because institutions can set up their requirements of what they're looking for, and as was mentioned, there are now a lot of agencies out there. I think COVID bred a huge bloom of agencies, and so now you can set your requirements for what your needs are in your facility. 100% right. There's actually an interview process that happens when you're bringing on a travel nurse to say, okay, I've got these shifts open. Does this work for you? No. Okay, let's look somewhere else and figure that out. I think most importantly is, and I think Brandy, you might share, is we're all on the same team. Like when it comes to this, it's like, how do we get in and work and care for patients, and we figure out where the right match is for people. And like Shante said, sometimes sometimes it's the wrong match. They get an assignment and people, and we've had travel nurses say that to us, like this isn't what I thought it was.
Yeah.
And we work hard to say, okay, how can we flex around? Your contract says you're working this unit. Can we work something? And 90% of the time, people are willing to say, okay, I want to stay here. You're going to work with me. I'll make some adjustments and we'll work it out. But the core requirements, and I agree, whether it's LPN or RN, like we're a team of healthcare folks. I mean, we were, and that's actually something that helped a lot of our hospitals come out of the COVID era with, balancing the dependency on RNs versus LPNs. A number of hospitals that I work with and are partnered with, they're doing a team-based care model now that they weren't doing before. And that team-based care model is relying on the LPNs to work top of license, the RNs work top of license, your technicians supporting you, and patient satisfaction is higher, outcomes are better, and the overall experience works well. So I think as we bring it all together, whether you're working for a travel agency or you're a core employee, you're part of that team once we enter the doors, and we try to make that work out as well. And I think the one other question you asked about why be a nurse, and I would tell you, I think you'd all agree, it's probably one of the most rewarding fields there is, and it's the most diversified field. Like
You've been a nurse for over 30 years then, right? Yeah.
I'm GCC alumni. And you know what? It's been every part of nursing that I've touched has been rewarding, and whether it's, I did some clinical IT at one point in time, and to see the impact you can make on the nurses who are doing the work in IT systems is just as rewarding as holding the hand of a patient who just needs a moment to feel comfortable and sharing that compassion and that empathy that we share. So it's the nursing field is just, and I think we have to get that message out there, because I think people heard a lot of bad stuff over the last 5 years or so, and I think any of the nurses that are working in the field today would say, it's still the most rewarding field, and it's still, there's so many opportunities to do things and have people that open doors like the one that did for you. I mean, that's half the battle, is somebody who's willing to say, I'm behind you, I'll support you. I remember my beginnings started when I was actually a roller skating skate guard, and the guy I worked with was an EMT, and he brought me all his medical books, and that inspired me then to read more about what that was, and got me into being an EMT, and then eventually right into nursing school. So it's somebody setting that spark, and that's what we want to be able to do.
Yes, and I know sometimes the spark probably dimmed a little bit during the COVID pandemic, right? In 2019, about 2% of all RNs were travel nurses. The need for travel nurses skyrocketed during the COVID-19 pandemic, with one researcher said up to 10% of all nursing staff worked as travel nurses in 2022. And I want to speak with all of you about I want to take me back to your experience during the pandemic. And what that was like for you as a nurse during that time.
So,
you can go ahead.
Sorry. So, I became a travel nurse here. I was a local traveler. That's how bad nurses were needed, and I was at RGH. Loved it. Loved my experience. In the beginning, the new nurse, the new traveler, But the experience was great. And being at RGH as a travel nurse during that time was a lot. It was, in the hospital, you have a whole lot of changes. Things were changing every single day. Like, CDC, everything was changing every day. So one day you did something, tomorrow you can't do it no more. So it was a lot of changes. Things were moving fast. In those moments, I realized that this is why I do what I do. This is why I chose nursing. This was the rewarding part, being able to, be with those who families couldn't be with them in the worst time ever. being able to, help my colleagues, deal with whatever situations were going on the units, being flexible, showing that teammanship and being able to, float over here and go over here, even when, sometimes you want to stay on your unit, but if other units were in need and, you're able to do it, to just go be able to help other nurses, because it got hard, because even with travelers, you still were short.
Yeah.
Even with travelers,
Yeah.
you still had 7-8 patients that, were acute. So they were like critical. You can't, it's too many patients to watch for one person.
Yeah.
So even in those moments, pulling together as a team, you have your charge nurse, you have the other nurses, even with the, LPNs on the unit, because before LPNs, they were taken out the hospital. They came back.
Yeah.
They
That's
came
huge.
back because the need was in that. I'm so appreciative of that, because, you have some really great LPNs that, from one, they know their stuff.
Skilled.
Two, they want to learn more. And, they're a great resource, and they're very helpful in the things that they can do. Some people in nursing, they want to do the bare minimum. They don't want to do, they don't want to operate with under their scope.
Yeah.
But those nurses that do, you appreciate that, because it's things that you can do, the things that you can help, and working together as a team made those moments so much better, because, getting patients fresh out of surgery that you got to watch, and you got 3 of them, then you got, somebody that's getting ready to fall, then you got somebody that is, on their last, and then you got families, and, it's a lot. It's a lot. So being able to have that team put in place where you can, lean and call on your coworker was great.
It was great.
I think I love what Brandy, you illustrated very well the immense amount of change that happened in hospitals across the country on a day-by-day basis. What my reflection was of that, though, was the amazing resiliency of our nursing team. And I saw a team come together at the hospital I was at out in Batavia. Whether they were travel or not travel, they became that team, and they were resilient. Today you got to wear this mask. Nope, tomorrow you got to wear this mask. Oh wait, we've got these homemade masks, and every bit of change was happening. But it was that, I have to say, it was that nursing resiliency that kept up with those changes and saved lives.
Yeah.
I mean, they really saved lives. Our nurses stood by conditions that no one in any of our generations thought we'd ever have to work in. And when they did the very, very best for patients. I mean, we had nurses working out in tents in parking lots.
Yep.
Nobody thought
I
in the
was
United
there.
States we would have people in tents in parking lots, but they were. And they were keeping people safe, and they were and so it's that resiliency. And I think that's something that nursing has held true to in all of nursing, all of time, is that we are resilient. We can make changes quickly, and we can look for what the evidence says and make it work. And that's something I was so proud of our nurses. And it was touching one day, just a story. I came to work that morning, and somewhere during the middle of the night, somebody from the community came out and wrote in chalk on the sidewalk, "Thank you, nurses." And so every nurse that walked into work that day saw that someone from the community, unbeknownst to us, did that. And they brought food trucks to the facility. They did everything they could to say thank you to the team of people that were helping their neighbors and loved ones. And that's what makes it so special.
Just thinking back and imagining that, I can't believe that we went through those times not too long ago. And you said, Brandy, that LPNs were coming back in. Jeri, you're LPN. Were you told to come back in the hospital?
I did work in a hospital during COVID, but it wasn't when COVID was crazy. It was kind of like when COVID was calming down and you could wear the mask or you didn't have to wear the mask.
Yeah.
I was in the hospital during that time. But my experience, what I don't hear a lot of people talk about during COVID, was in the prison. And a lot of people, when they think of nursing, they think of hospitals or nursing homes. But I was excited to go to the prison because I just wanted to experience something different. I was like, oh, this sounds cool. But when I actually got there, these guys are stuck in a building. Where they say like going outside is like the most healing thing that you can do around COVID. They were stuck in a building. So you would have a floor of 400 men all sick, and some of them are passing away. and they didn't get to see their loved ones before they left. They didn't get those visits that you normally would get because visitation got shut down.
Yeah.
So there was just the good people in their eyes were the nurses, because you got the CEOs they're not really their friends for them, So they just had the nurses. So it was a very humbling experience to be able to be there with some of those guys passing away without their families. So for me, it was war. It was wartime. I felt like I'm not in the military like my parents were, but this is a different type of fight. We have to get up every day and show up, and everybody worked as a team. I never experienced so much love and support and community than I did during COVID. And everyone loved the nurses. We were like the superheroes of those. We had 2 years and we were superheroes, and everyone. We had free Crocs. We had food, most days. Discounts everywhere. North Face. We had 50% off. So we had so many great benefits. But it's to me, it was we needed that to keep going.
Yes.
Because a lot of times we would come home to our families and we're scared to get our families sick. There was one way in my house and one way out my house. Yeah. And everybody knew that. Don't come in that wrong door.
Wow.
So it was a different experience in prison.
Wow. I appreciate you for sharing that perspective, because we don't talk about prisons. We talk about, like you said, hospitals and nursing homes. And we don't realize that the nursing field expands past those walls, those hospital walls. So I appreciate that perspective. Shante, were you on assignment elsewhere? Were you called to New York City or anywhere that really needed?
I ended up I started doing COVID swabs here in Rochester. Then I went to Miami to do COVID swabs. And then I ended up in Texas. And just like how Jeri said, I worked in a hospital. It was ED, med surg, and that was a very humbling, very emotional, and people thought, oh, COVID is a hoax. COVID isn't for real. But when I left that facility, a quick story. I had a patient. He came in for a high blood pressure. Okay, we're going to treat the high blood pressure. The hospital was probably 15 minutes away. We couldn't keep him there because it was in and out. Ended up sending him to his O2 level was going down, placed him on nasal cannula. Us nurses, we know the lingo. So then we had to
feel so out of place. It's the first time I ever feel out of place here.
And so we had to BiPAP him. BiPAP wasn't working. And I ended up sending him to the hospital. And so he ended up passing away. And I was just he only came here for his blood pressure, so it's for people to say, oh, it's not real, this is fake. And I was I was here doing this, you know what I'm saying? So it's just it was an experience working, with COVID. So then I ended up going to Buffalo, and I worked with COVID patients for 3 months. So BiPAP and O2, Trendelenburg, all of that. And it's just you just are very thankful when you're on these assignments, and how you can help the patients. You get to hold the patients, hands when the family isn't there because they couldn't have visitations. We were gowned up our whole 12-hour shift. It's basically how you said, being in the military, you have to put your mask on. When we step out, take everything off, come back in, put your mask on, put your goggles on.
That was half of our shift changing.
And it was, changing. It was just changing your clothes. So COVID was very an emotional time, and thank God it's over, but it was an experience to to go through during those times. So
and I would say another thing that we didn't talk about as much during COVID was the lack of human touch. Because we were so gowned up, there was never with our patients how we would hold their hand, touch. I didn't know how important that was until COVID. When people were depression was up here, suicide rates went crazy from people not being able to see people. But the physical touch, I felt like it was such a simple remedy that we were missing in the nursing field, that as nurses, we were we can't do this. And as the patients, it's you shouldn't do that. But it's it was such a necessary thing that outside of medicine and outside of what we learned in school, we need like that physical touch to survive.
Yeah.
It's a very simple thing that went over a lot of people's heads. So I was the hugger. They were like, Jeri, stop hugging people. Stop hugging people. I'm like, I can't help it.
I would definitely agree with Jeri at that one,
Mm-hmm.
because even with our demented residents,
They knew.
they thrive off of, that touch, that communication, that,
Yeah.
and not being able to do that with them, they got depressed. And, when the elderly, and especially with dementia, once they go down, it's hard to get them back. And they were
And you were losing people just off of
passing
that.
just
Yeah.
because, they were saying broken heart because
Yep.
they couldn't see their family, and the family that they thought was their family, which was you, they couldn't touch you. You couldn't touch them. And, you couldn't just sit next to them and, talk to them and do their hair and, rub their hand and things like that. It was very, very hard for those residents.
It was so interesting to have to switch and actually do video FaceTime
yeah,
with
with the
families, just because that's the only way they could see each other. I mean, that isolation is huge,
Yeah.
and it's I think it still has its long-lasting effects on people that have come out of COVID, and on all of us. The
Yeah.
weight I think that nurses have carried through what they saw. Again, this is something none of us ever thought we'd experience in our lifetime, and now we're carrying that, and now we're describing it to our
Yeah.
children. We're describing it to, people who are, just this will be new for them, but we have lots of lessons out of it. And,
Absolutely.
So I know this could have got pretty expensive on the healthcare systems. We'll talk about cost and payment right after this break. Stay with us. We're talking about travel nurses right here on WXXI.
Support for your public radio station comes from our members and from Mary Cariola Center, supporting residents to become active members of the community, from developing life skills to gaining independence. Mary Cariola Center, transforming lives of people with disabilities. More online at marycariola.org.
Cariola.
And we're back with WXXI News. I'm Racquel Stephen, and today we're talking about traveling nurses and the systems that hire them. In studio with me, I have Shante Hill. She's a registered nurse and a traveling nurse based in Rochester. I have Jeri Hayes. She's a LPN based in Texas and on assignment in Rochester. Brandy Brumfeld, the director of nursing at Wesley Gardens nursing home, and Daniel Ireland, the chief nursing executive with Rochester Regional Health. And Dan, you have the honor of speaking for the entire RRH system when it comes to this topic. Now, I know the system depended heavily on travel nurses during the pandemic, but now it says the need has decreased by 40%, right? What was it? What was the financial impact of having travel nurses?
It was tremendous. We saw such an exodus of nurses, either that were late careerists and as soon as the pandemic was happening said, I don't want to go down this road. We saw people leave to travel because at one point in time, the people thought they could go somewhere else in the country and be less impacted than COVID than here, which we all learned wasn't. So I'll give a perspective. In 2019, as a health system, Rochester Regional Health spent about $9 million on travel nursing. So travel nursing's been around, as we've illustrated, for a long time. We use them to cover disabilities. We use them when departments were short-staffed for a longer period of time, and you would do those contracts. So we did use them. At the height of COVID, we spent $260 million on travel nursing costs to be able to cover the need. And it's something that I think if you talk to any of the leadership team and whatnot, if we had to rewind and do it all over again, we'd do it all over again. Like, it was about getting care for the patients. It's about keeping capacity in our community. And that's something that our health system does, is when the need arises, and I'll just say all health systems, but when the need arises, you step up to that need and you figure out how to navigate through the immediacy of it. But then as COVID has gone down and we've seen more people coming into the market, as more nurses coming into the market, we've been able to bring back more core nursing. We've actually been able to increase the capacity in nurses going through nursing school now. Rochester Regional had an LPN program before COVID and bridged in and has added an RN program, so that we have both LPNs and RNs graduating. 61 graduates this year between the RNs and LPNs, plus all our partner schools have increased capacity. We have to fill this void. It's not a Rochester void. Nationwide, the data shows that there's a nursing shortage around our country, much through 2030. So there's going to be continued effort about that. But we have brought down the percentage of agency nurses that we're using. At the end of last year, we were running about 35% of our nurses were agency.
Wow.
We're down to about 24 now. Okay. And we've also branched into some other areas. There's a huge opportunity for global nursing.
Yes.
And so we have nurses that are coming from the Philippines, Puerto Rico, the European nations coming in as well. They want to come work for us. And so pulling all those levers, doing all those things, we're doing everything we can to get back to that core nursing. Somebody asked me once, do I ever think travel nursing would go away? And my answer is no. I think there's a need. There's a true need for it to happen. Does it need to be as high as it has been? That's unsustainable given where the cost difference is. But there will be a need, and as we've said all the way through the pandemic, our travel nurses have been our lifeline. They've been our partners. And in many of our organizations, I'll walk up on the units and I couldn't tell the difference and they're treated like family. I know there's always exceptions, but the general rule I felt was that, most people really valued the folks that came to help us out. And we continue to value them as we navigate our way into changing times in healthcare.
Yeah, perfect. I know I have a caller who wants to talk about money and finances. I have Louis, I believe it's Louis from Brighton, and his question is about pay. Luis from Brighton, are you on the line?
I am.
Hi, how are you?
Thank
Yes, you're live on WXXI. You have a question or comment for our panel?
Yeah, I think it was somewhat covered. I wonder how the business side for the agencies, how much are they making out of this? And thinking more about all the costs are coming up now with Medicaid and Medicare. Is that going to be affecting staffing for nursing? And is that going to is travel nursing now is going to be part of a way to address the cuts that are going to be happening?
Yeah. Okay. Thank you, Luis. I don't know who wants it. Dan, if you want to tackle that question.
I'll jump in first. We recognize the fact that the agencies perform a function, and so they get a cut of the pay. So if the hospital's paying a certain rate, we know that the nurse is making somewhat less than that, and the agency's keeping their cut of it. Like any business, like any consumable business you would have, you always try to hope that the agency gets the lower cut, the nurses get the money, and we always try to keep our costs low. So one inventive thing that we have done, and I know other health systems are doing too, is we've tried to create our own internal travel pool. So we know that there's the travel bug, as our colleagues here have said, but some people are willing to travel within the region. And now when you have a system that has 8 or 9 hospitals, they're willing to travel amongst those different hospitals, but work for our internal agency pool, so they're able to move around, and it has a differential compensation, so it's less than what we'd be paying the external agencies. Taking the middleman out of it, basically, is what happens. But it helps tap that need and that desire for the workforce of today that wants to be able to not just be in one unit all the time, but move around. With the respect to the Medicaid cuts and the cuts that are happening, I think that's going to put a new focus on how we manage. And I believe everyone, including the agencies, the insurance companies, everyone is going to have to come to the table during this time and say, most important thing is we keep healthcare viable and we're able to keep nurses at the bedside. How do we work through that? And I think the more we have those conversations, the more we're able to navigate through changes in healthcare, which we'll always have, and really get us to the other side and make sure that care is kept where care is needed.
Yeah, great. And Brandy, how does this play in with nursing homes and agencies?
Well, in the nursing home and agencies with regards to the pay, and we do have where, of course, in-house staff is how much you making, what they paying you, because they, and then they also, like we said earlier, want to give the hardest assignment, or you go work the floor with just one nurse, for the residents, and and things like that. But as Dan stated earlier, we're all here for the same reason. Our focus is ensuring that our patients, our residents, are receiving the care that they deserve. And in doing that, as the director of nursing, that's part of what I strive and I teach on a daily basis, is that you have to be passionate to be a nurse. This has to be something that you want to do. It can't just be the money. We need the money, but it can't just be about the money. It has to be about ensuring the safety and well-being of the people that we're caring for. And in doing that, is it fair to put someone that's new in our facility on a floor that they don't know, by themselves, with no support on the floor with them at that time, just because they're agency, or just because they're making a couple more dollars than you are? And I have to put that perspective to my staff and let them know, because yesterday you didn't want to do it, but you work in the building. You didn't want to do it yesterday. And in doing that, they kind of look at it from a different point of view, because if we don't have the agency, they're by themselves. We need the agency. We need them. So putting it out there to them in that sense, and kind of taking it away from the monetary part of it and taking it back to the beginning as to why we all are here.
And how do you keep things fair, Dan, when you have that kind of back and forth between coworkers?
Well, I think it's putting a perspective too. Like, people will stay in a core position and not travel because they want certain things from that core position. There may be a benefit that's offered by the institution. There's stability that I'm not, because a lot of our contracts will go usually in 13-week increments, sometimes 8 weeks or 6 weeks, but 13-week increments. And so you live, even though there's a need today, you live with the risk as a travel nurse that at the end of that 13 weeks, the organization is going to say, we filled our spots and you have going to find another assignment. Today, and please, my travelers tell me, but today I think the worry has been a lot less because there's lots of assignments still out there and you can still get a lot of that. But, some people have not gone to traveling because they want that stability, that family stability. They don't want that risk. So you try to balance it and say, well, what, we always try to pay the market rate. We try to pay what's fair with the market, and do the best we can and offer the best benefits that we can for our folks. But recognizing the premium that the travel nurses are getting, they're getting it because they're taking risk. And early on, some of the travel agencies weren't even offering any health benefits or anything. So they were, you had to respect the fact that they had to make sure they had money to, or if they had somebody who was their health plan they were on. But so that you try to balance out that equity and work through it. Some people understand that in the conversation. Sometimes people still feel it's unfair. I have to agree with Brandy, though. We work really hard trying to say you have to keep the assignments balanced and fair, because you lose those travel nurses because you're abusing them and you've really lost your ability to care for the patients. And so we want to be fair all the way around. That's why I say we care like family, even to our travel nurses. They're our family.
And for the most part, I feel like most of the facilities I work at has been fair with trying to make the workload even across the board. I do feel like that.
Because we don't really hear about the disadvantages of being a travel nurse. We hear about the good money, but are there disadvantages? I
would say the disadvantages are sometimes when you get to the facility, the nurse to patient ratio, again, like your coworkers, management. It's just some things you may or may not get around. Your recruiter may say, oh yeah, this is a great facility, and then when you step on the floor, it's like what done broke loose around here, so it's like, I'm seasoned, so it's like I have like a whole thing of questions that I ask, so the recruiter be like, oh, have you done this before? Oh yes. So we're not about to play those games. We're going to get down to business, and that's going to be that. So a lot of the agencies be like, okay, we can't fit your pay or your hours in because so-and-so, because I've been doing this for a while, so you're not about to play in my face, So, it's some disadvantages, like I said, your coworkers, the nurse-to-patient ratios, management, sometimes pay. But then again, I tell people you have to do your research.
Yep.
Do your research, because if not, again, when you step on the floor, it's like, what happened?
Yeah.
So.
Yeah. Yeah, I have a comment here from someone on YouTube on YouTube. And Rob in Rochester, he says, can they discuss being a travel nurse going from house to house, not at a hospital, but on the road going from patient to patient? Is that a thing? Would that be considered a travel nurse or an aide?
That's more like home health care.
Yeah. Okay.
I don't do that though.
Okay.
Yeah, I don't either.
Okay. I want to talk about burnout, right? Because travel nurses experience a significantly higher rate of burnout, emotionally drained, used up, fatigued, at least a few times per week compared to non-travel nurses. Do you experience a higher degree of burnout as a travel nurse than a non-travel nurse?
That's why I travel though.
That's why you travel.
That is the main reason I travel, because I don't believe in carrying extra stress in your life. And if I say I'm going to take this assignment for 6 weeks or 8 weeks or 13 weeks, I know I'm here for that amount of time, but I could take a break. I'm not attached to a facility where I have to wait for my vacation time to roll over. I could be on vacation right now. Just give me 2-3 weeks to get myself together and go back into it. So I always give myself at least 2 weeks before I go back to work.
Assignment. Oh,
That's a good benefit.
That's a good strategy right there.
Always.
You're gonna give some travel nurses
Girl.
some ideas. Now,
And another thing, what we were saying before, real quick, it's important for travel nurses not to talk about their pay to other people. And I think that does kind of create the friction that I did experience as a nurse. If they find out that I'm making, but that would be me telling them. It could be rumors going around, but I am a negotiator. I negotiate usually because I've been doing this for a while. I know that I can negotiate. I know that there's a middleman that's taking part of what I could have.
you're the middleman.
I know there's a middleman. So I'm going to negotiate.
Now, Dan, I want to talk about technology, right? And advancements in technology and how that is helping reduce the workload as well, right? When we're dealing with whether it's AI or what are you guys doing at Rochester Regional? I know you had a Moxie robot at one point. How did that go?
That's going fantastic. We have Moxie robots at Rochester General and Unity, and the one thing the Moxies have done is it has reduced the amount of time the nurses have to leave the floor to run and get stuff. Like we don't. No hospital I know of has perfect environments where everything is where you need it to be. So someone's running somewhere, and oftentimes, especially in lean departments, the nurse is the one doing it. And now Moxie's been able to help that, and tens of thousands of steps have been reduced, and that's more time at the bedside. We're be able to do that. Virtual nursing, it's a real thing now, and we're we have a couple pilots going on right now, 2 at RGH and 2 at Unity, and we're mapping out an expansion of that. But that's a nurse in a central location watching over 12, 24 patients using AI that's got built-in technology that. And I was amazed when I saw this, but it has built-in technology that actually can sense the movement of the patient in the bed and can predict if the patient's going to try and get out of bed before the patient even looks like they're trying to get out of bed. So it allows that nurse to intervene and say, wait just a minute, I'm going to call your nurse and get somebody in there. All of that is really taking the workload of the nurses and changing it. And and I don't want to sell a story that it's going to be magically lighter but we all know as nurses we have to continue to change the workload because the whole healthcare environment's changing. So let's make those changes. Let's free that up so I can teach on a higher end drug and spend more time with the patient in one room while I know that the virtual nurse is watching my other patient over here and working through that. And then telehealth is the other one, and more getting care to the home, even virtual urgent cares, all that technology, changing the flow of patients so that we're only putting the people who really need to use ERs in ERs. We only are, and you're getting people care where they need along the way. So tremendous investments, in Rochester Regional Health. My little plug, because this is what I'm passionate about, is we've doubled down on innovation. We have many of our hospitals have innovation hubs now. We are teaching our people how to do human-centered design. We're encouraging people to pilot projects and change things. We are going to be the forefront of how healthcare changes. And I personally, as a leader in nursing, want to make sure nursing is right there at the front of the line, saying, you know what, we've got complex world problems that we're dealing with in our patient care areas. Let's fix them here. and let's be the example for others. So it's really it's.
I see your little recruitment there. I see it.
Yeah, you know.
They're listening. They're like,
Always working.
Ladies, I want to know how do you feel about AI and advancement in technology in your field? Are you scared at all? Do you feel as if you will always be needed? What do you feel about AI?
Well, I feel that we need help. We do need help. I do feel like one of the things that I do love is telehealth, because in an emergent situation, especially in a nursing home, the doctor or the provider is not there 24/7. But if I can always do telehealth and they can see the resident and we can kind of figure out what's going on, it can prevent some rehospitalizations, at night or when everybody is gone. My nurses and my managers, they can, just get the iPad, go on telehealth and have a visit and get something prescribed or things like that that will help the resident be able to stay in the facility, and we can do things inside. So I do think that telehealth is a great thing, and for psych too. Like we use psych telehealth, which is great. So that benefit helps us out a lot with our residents.
Yeah. Can comment? Would any of you not do travel nursing anymore and just stay by the bedside or non-travel?
Would we not?
Yeah.
I think I will always go between the two. And being that is, as in the nursing home, your skills are a little different than in the hospital. In the hospital, you do your skills, and in nursing homes, you have less skills. So going between the both, it keeps you on your skill level.
Well, we can all conclude that nursing is a team-based sport. And everyone is valued, non-travel and travel nurses. Thank you to my guests for coming with me, Shante Hill, Brandy Brumfeld, Jeri Hayes, and Dan Ireland. Thank you to everyone in the booth. And thanks to all our listeners. Don't forget to subscribe to Connections Podcast so you never miss an episode.
This program is a production of WXXI Public Radio. The views expressed do not necessarily represent those of this station, its staff, management, or underwriters. The broadcast is meant for the private use of our audience. Any rebroadcast or use in another medium without expressed written consent of WXXI is strictly prohibited. Connections with Evan Dawson is available as a podcast. Just click on the Connections link at WXXInews.org.